A growing number of products and services that are crucial to seniors are categorized by the Centers for Medicare and Medicaid Services as deluxe and require an out-of-pocket copay from the Medicare patient. And here to talk with me about this is James Paiva from Conformis. James, welcome.
Thank you for having me, Bob. Really great to be here.
Pleasure. So a lot of our viewers and listeners and readers may not be familiar with this notion of deluxe when it comes to Medicare. Tell us more about that.
Yeah, sure. So for those of you who are on Medicare or Medicaid, you know that they are required to cover basically the bare minimum when it comes to healthcare services. And due to some of the challenges that we see with the US healthcare system, Medicare and Medicaid have really been squeezed from a cost perspective. So they're looking to reduce costs as much as they possibly can, as often as they possibly can. And so that's resulted in them really being very selective and stringent about what they cover and don't cover. And unfortunately, it typically does not cover the latest and greatest technology and services. So there is a provision within Medicare and Medicaid that allows for covered persons, retirees and such, to pay for out-of-pocket services or out-of-pocket technology that is beyond the minimum required of standard of care. And that's what falls into the deluxe category. And more often, this is becoming the standard of care, unfortunately. You see it with post-operative services like getting your own room rather than sharing a room with someone. You see it in the dental world with getting crowns or getting white fillings instead of metal fillings. All those are considered above and beyond the minimum standard of care and fall into the deluxe category. And that's growing to more and more technologies, including orthopedic devices.
So when it comes to deluxe, just a step back, most people are familiar that Medicare Part A covers X, Part B covers Y, Part D covers prescription drugs. Typically, these deluxe services would fall within any or all of those parts?
No, they fall outside, right? So a deluxe service is something that has to be paid out of pocket by the patient, but is allowed by both Medicare and Medicaid.
Right.
So it's considered above and beyond the standard of care.
Right. So none of these deluxe services would be covered by Medicare at all then. Is that correct?
Yeah. So it would be completely out of pocket.
Right. So what do you find in terms of people's willingness to pay for these deluxe services?
Yeah, I think the unfortunate reality of the U.S. healthcare system is, Americans understand that their healthcare coverage doesn't get them what it used to. And that if they really want the best, the latest and greatest technology, they're probably going to have to pay for it, at least part of it. I know I just had to pay for my son's braces, and I have very good health insurance, but they only covered the bare minimum. And for me to step up to the braces that are white and blend in with his teeth and don't require a headgear, I had to pay a significant portion of it out of pocket. So I think Americans understand that. And so we see a willingness to pay for our deluxe services in the orthopedic world about 30-40% of the time, regardless really of the patient's means or their socioeconomic background, because people realize the value of having the best possible healthcare. And that's probably even more important when it comes to orthopedic technology, because there are very few things that affect the quality of life more than being able to be, functional and healthy and mobile. And so I think people understand that it's an important thing.
Yeah. So just a step back one, you mentioned personalized knee replacement, which is the business that you're in. If someone was to have a non-personalized knee replacement, would that be covered typically under Medicare?
Yes. So total knee replacement today is covered by most insurers, I think by all, and certainly by Medicare and Medicaid. That covers your sort of standard, quote unquote, off the shelf implants, which are mass made. And for the most part, you'll do relatively well. Those patients, 80% of the time, have a good outcome. However, 20% of the time or so, for whatever reason, the patients don't do well. And that's where our technology comes in. We make an implant that's just for you. It's literally based on your anatomy. We reproduce what your knee looked like when it was healthy. And so it fits you better, just like a custom suit would fit you better, a custom dress would fit you better than something you took off the rack at Nordstrom's. And we actually reduced that 20% dissatisfaction rate down pretty significantly. However, it's expensive and time consuming, much more expensive than stuff that you can stamp out, mass produce. And so it's more expensive to do. But we believe it's worth it. And there are many, many hundreds, thousands of patients who believe it's worth it as well, and are willing to pay out of pocket to get that upgrade to a fully personalized knee implant.
Right. So I guess maybe speak a little bit about what the cost is, and then more importantly, how do folks save for the cost that they may incur?
Yeah, so the cost really depends on the standard of care. I mean, the site of care where you're getting, because there are facility fees and they're associated with that, but it can be anywhere between $3,000 to $4,000 above and beyond what the insurance company covers. Now, if you think about it, this implant, if you're healthy, is going to live inside your body for 20 years plus, right? So if you average that out, it's not a significant investment to insure, basically guarantee, in quotes, to mostly to as high as possibly ensure that you're going to have a great outcome with your knee replacement. So that range. And so how should retirees look at saving? I think retirees look at saving for boats and cars and second homes. Knowing where U.S. health care and insurance is going, I think retirees should be thinking about that they have to have some money put aside for these healthcare expenses. And it's not just for orthopedic implants. We're seeing it across the spectrum of specialties with eye care, whether it's intraocular lenses or getting LASIK surgery. I already mentioned dental work. That's very common, popular. Snoring devices, if you have to get a custom mouthpiece that prevent you from snoring, that's not covered. And I could go on and on and on. And so
hearing aids and so forth.
Deluxe hearing aids, the hearing aids that match your skin tone. The list is really endless. And so I think retirees should be thinking, really long and strong about, what their health is worth to them and what value they place on being able to have access to the best technology and not settling for what Medicare, Medicaid deems is the bare minimum.
Mm-hmm. So in terms of what kind of accounts or vehicles someone might use, obviously, in some cases, you might have access to a health savings account. In other cases, you might have just an ordinary IRA or a taxable account. How do people plan or think about using these accounts to save for and plan for these deluxe services?
The good news, Bob, is there's a variety of ways that patients and retirees can pay for these types of services. You mentioned health savings account. Is also flexible savings accounts, which are typically pre-tax that you pay into. And these services and technologies that fall into deluxe category are completely compliant with those programs. The other option, of course, is there are companies in particular that do credit, right? So there's a company we have a partnership with called Care Credit, and essentially acts like a credit card. They fund these type of expenses, and depending on the program you choose, it can often be zero additional interest to the patient, depending on how they fund it. And then, of course, there are some tax benefits as well, as you mentioned, for paying out of pocket. Once you meet your threshold for the year, when you file your yearly taxes, that you can claim these as an expense.
So, James, one of the things that our readers are familiar with is various studies that say that they'll need to set aside $250,000, $300,000 at age 65 to pay for 20 years of healthcare costs in retirement. Other research suggests that it's really relatively easy to pay for the common and well-known expenses like your premiums, and you can do that from maybe cash flow through Social Security, through a pension, et cetera. And that the more difficult expenses are these out-of-pocket expenses, but that in many cases you could also use discretionary assets, i.e. the money in your 401k or IRA, to pay for these extra and perhaps less common expenses. Any thoughts about that?
Yeah, I would say, I think that's probably a slightly conservative estimate, depending on the lifestyle that you live and how active you are and what you intend to do in your retirement. There's also, of course, history. You should know your family's history. I'm certainly not a doctor and can't make those recommendations, but family history can be a good predictor of whether you're going to have osteoarthritis, whether you're going to need a knee replacement or a hip replacement, whether you're going to have other functional problems. And we know mobility and functionality, unfortunately, affects the rest of your health. So if you can't walk properly because you have knee pain or hip pain or back pain, it's going to affect the rest of your health, your weight, your mental health. So you should know your family history. That's very important to determining your risk. That's the first and foremost. The second thing I would say is, because of the changes and the pressure that the financial pressure that is on the healthcare system, again, I don't want to predict, but if you look at what's happened over the last 5 to 10 years, health, even private health insurers have reimbursed less and less and less, and they've cut costs of what they're paying for. They've squeezed on how much they're willing to reimburse hospitals and the providers, which has made it difficult on that downstream side for them to survive. And there's no sign that that's going to let up anytime soon. So I imagine that this pressure is going to continue into the future, and more services are going to be uncovered. And more implants and technology are going to be uncovered. And that's probably something that you should plan for.
Yeah.
And so I would suggest that those estimates are probably on the conservative side.
Yeah. So it seems like I can't go anywhere in my life without someone talking to me about a knee replacement that they've had, or that they're scheduled to have, or need to have. What advice do you have for folks who are going to their doctor and talking about either total knee replacement, either personalized or not?
Sure. No, it's a great question, Bob. And, I'll say again, I'm not a doctor, so I don't want to give medical advice. However, I think there are some common best practices. First, I would certainly talk to your surgeon, talk to your doctor about any risk factors you may have, whether it's the family history, whether it's your anatomy, whether it's your activity level, and really understand, why you may be unique and different. Then I would talk to your doctor about the options, what the options are. Of course, conservative care should always be your first choice. And there are lots of great conservative care treatments. However, when you've exhausted those and your mobility is being challenged and threatened, you should act, because unfortunately, once you get to some point in your life, those bones aren't going to heal themselves, and they need to be surgically helped. And I would talk to your surgeon about what the options are. I'd talk to them about what type of implant they use, and ask them if doing something that's fully personalized, made just for me, would potentially benefit me. Certainly there are, arguments on both sides, but we have some strong clinical evidence, like I said earlier, that suggests that, we have, a much lower chance of dissatisfaction or revision long-term.
Yeah. So we've talked a lot about knees. Obviously, hip replacements are also a thing that many older adults need to have. Any thoughts about that before we wrap up?
Yeah, so hip is a very effective procedure. I mentioned that 20% dissatisfaction in knees. It's even lower for hip. It's probably in the 5 to 10% range. However, there is some benefit from doing a fully personalized hip. So we make that as well. It's made just for you. We can adjust it to fit your native anatomy and try to recreate the exact angle you had, before you needed surgery. And we've seen some significant benefit for patients getting a fully personalized hip. So I would also, if you need hip surgery, I would talk to your surgeon about what the options are and if a fully personalized hip may benefit you.
All right. So James, we've covered a lot of ground. Anything we missed, or anything that just bears reemphasizing?
Yeah, no, I appreciate the opportunity, Bob. And I would just, I would urge your listeners, readers, to really think long-term, about their health. It's easy if you're healthy now, you retired recently, you feel good. You're like, it's easy to sort of dismiss it, but people are living longer than ever. And Medicare and Medicaid was not really built for people living into their hundreds, and so that is going to continue to be squeezed. And you need to think about how important your health is to you, and invest in your health like you invest in any other asset. It's probably your most important asset.